Hello, everyone. Thanks for joining the webinar on evidence-based management and science communication for COVID-19, jointly organized by the Harvard Club of India and T.H. School of Public Health, India Research Center. My name is Sanjay Kumar, and I am the India Country Director of Lakshmi Mittal and Family South Asia Institute, and I am also the President of Harvard Club of India. So here I am representing the Harvard Club of India today. I'm pleased to inform you that this is first in our webinar and discussion series named India Matters. Under this broad theme, we will be organizing many more webinars and discussions which are relevant and timely for our country and for the community. The topic for today's webinar is the most relevant for the current difficult time we all are going through. In this time of crisis, I would like to express gratitude to each member of the Harvard community for actively helping many people in the country utilizing the strength of the community members. I would also like to share that we became part of two fundraisers, one with the current students of Harvard and other US universities, which raised about 1.5 crores INR, and the other one is with alumni clubs of US universities in India, which raised about 27 lakh INR in the last few days. Both fundraisers collaborated with Give India for COVID emergency relief. I would humbly request each of you to help us amplify the current fundraisers and individually request your friends and families to contribute generously. I would like to welcome our guests for the webinar today, Dr. C.S. Pramesh and Dr. K. Vishwanath. Dr. K. Vishwanath is Professor of Health Communication at the Harvard T.H. School of Public Health and the Director of Harvard Chan India Research Center. He also serves as the chair of the Working Group on Vaccine Confidence, National Vaccine Advisory Committee, Government of the United States of America. Dr. Vishwanath has an extensive track record of research in the US and globally on the role of health communication in health and well-being. Dr. C.S. Pramesh is the director of the Tata Memorial Hospital and a thoracic surgeon at the Tata Memorial Hospital and the convener for the National Cancer Grid. Dr. Pramesh has led a webinar series on evidence-based management and prevention of COVID-19 for the National Cancer Grid. He has also contributed to the guidance on home-based management of COVID-19 developed by the India COVID SOS group, which has been translated in 20 Indian languages. I thank both of you to be here today. And the session will be moderated by Dr. Ava Mandireta. She is the Vice President of the Harvard Club of India. She is also a non-resident fellow at the Center for Global Development and faculty for the Institute for Healthcare Improvement. Without a further ado, I would like to hand over to Ava and start the conversation. Thank you so much.
Thank you, Sanjay ji. So I'll give a brief overview of the session today. We will have a 40 minutes interactive discussion, which will be facilitated by my colleague, Dr. Ananya Avasthi, who is the Secretary of the Harvard Club of India. After that, we will have a 20 minutes of live Q&A, which will be facilitated by Dr. Sonali Ved. I wanted to request if you can please type in your questions in the chat box throughout the session while the interactive discussion is going, and of course when the live Q&A happens. And Sonali will be picking up questions from the chat box and presenting it to the panelists. And at the end, we will try to summarize the key points from the discussion and what the key takeaways are before we conclude. So I'll hand it over to Ananya now. Ananya, passing it to you.
Thank you, Ava, and thank you, Sanjay. And thank you to everyone who has joined us in these challenging times as we look for evidence-based, science-based answers to the most common myths, queries, concerns that we have for prevention and treatment of COVID-19. I'm Ananya, Secretary to the Harvard Club of India with a day job as the Assistant Director to the Harvard School of Public Health India Center. So without wasting another second, I will dive into my first question posed to Dr. Pramesh. So, suppose if I suspect that I have symptoms for COVID-19, what should I do based on the latest protocols for home-based management of COVID-19? And also, if you could tell us about some of those danger signals that we should watch out for, which may be indicative of immediate hospitalization. Thank you.
Thank you, Ananya. Before I start, thank you to the Harvard Club for this opportunity to be part of this very important session on evidence-based management of COVID-19. So your question is very relevant now for two reasons. One, while test, trace, isolate has been the mantra based on which we have managed COVID over the last year and a few months, the situation is slightly different now. So the answer to what happens or what should I do when I have symptoms of COVID is a little different from what it would have been last year. If you have facilities to get a COVID test, preferably an Rt Pcr, we need to go ahead and do that, because getting a confirmed diagnosis is key to managing the disease and to protect others from getting infected from the index patient. So the problem now has been that in several parts of the country, the waiting time for the COVID test is fairly long. So there is also this possibility of syndromic management, which means that if you clinically fit the symptoms of COVID, you consider yourself as positive for COVID, and even while you wait for your test, you take all the precautions that are necessary as if you had a COVID infection. So this is extremely important to prevent this chain of transmission, and probably one of the ways that we can actually cut this pandemic short, or at least flatten the curve to some extent. But possibly the most important bit to understand here is, if you have the ability to get a COVID test quickly and get the results quickly, both of which are in question in some parts of the country, you should go ahead and get the test. But in the absence of those, consider yourself COVID positive, isolate yourself, take all the other precautions that you need to do so with a mild or an asymptomatic COVID, and protect the others. This is very, very important to break this chain of transmission. Coming to your second part of the question, which was how do we manage COVID, mild infections with COVID? So let me start by giving the good news about COVID. It's a disease which has a very, very high recovery rate. More than 98% of people who get infected or who test positive for the disease actually survive the disease. And this is probably an underestimate, because there is this vast segment of asymptomatic, untested people who are surviving, and we really don't know about it. So the true survival rates from COVID is probably upwards of 99%. So that's the good news. The important aspect to remember here is that while you might continue managing yourself and treating yourself at home, which is probably the best way of managing asymptomatic or mild COVID, you need to keep some precautions in mind and some alerts in mind, some alarm bells, which will prompt you to seek hospital care or at least medical care. These, so what I would suggest to someone who, either with symptoms or with a positive test of COVID, would be, actually, if it goes even before they get tested positive or get symptoms, is to invest in a pulse oximeter and a thermometer. These are two key bits of equipment that you need at home, regardless of who you are, as long as you can afford it. If and when you get symptoms of COVID, maintain a temperature chart, even if you're isolating by yourself. Most importantly, check your saturation 3 to 4 times a day. The single most important message that needs to go out for anyone with symptoms of COVID is that oxygen saturation, or a drop in oxygen saturation, is the biggest alarm bell that you need to worry about if you need to seek medical care. And as a general rule of thumb, though the actual thresholds are much lower, it's actually 88 to 90% of saturation, which we consider as the alarm bells to seeking medical care. Given that access to hospitalization is challenging now, I would keep the threshold a little higher. So we've recommended that a saturation below 92% should prompt you to seek medical care, because there is frequently a lag period between when you want it and when you actually get the medical care. The other very simple way of checking, and a very early sign of deterioration in COVID, is to do what we call a 6-minute walk test. So you measure your saturation at baseline, which means that you measure your oxygen saturation when you're at rest. Do a brisk walk within the confines of your room, because you still have the symptoms. And at the end of the 6-minute walk, check your saturation again. And if there is a fall of more than 4 degrees, or if the post 6-minute walk test saturation falls to less than 92%, again, this is something that you need to keep as an alarm bell for taking care. There are plenty of other things that we could discuss, but I'll stop with this for now and wait to take other questions.
Thank you so much for a very comprehensive response. Coming to this entire issue of health information and channels through which health information is being consumed. So the next question is to Professor Viswanath. As you know, given your long-standing area in this work, social media channels like Facebook, WhatsApp, and Twitter are increasingly becoming, the most dominant platform for how we consume health information. At the same time, we do not have any institutional mechanisms to address misinformation and disinformation on social media channels. Given your research in this area, can you indicate some promising solutions that we may have in this regard?
Sure. So first, let me start by thanking everyone on the panel as the organizers and the audience for attending it. Your welfare and is uppermost in the minds of those of us who are several thousand miles away. You are in our thoughts and prayers, and we are all anxious here in working with you to be helpful over the night. As you are going through this crisis. As I keep saying, and others have said this, the crisis that India is going through is a global crisis. It's just not for India. Everyone in the globe will be affected by it, is affected by it. So we are all in this together, and therefore, so we are with you on this, in working with you. So having said that, so the issue of social media keeps coming up. And the role social media plays, and there is a lot of attention to the negative effects of social media. In fact, so let me just answer that briefly in a more nuanced way. I think the social media themselves have are continuing to play a significant role on the positive side, given the nature of the crisis and and how moribund most institutions are. Social media provided the necessary agility that is required right now. I see even some of the panelists who are on social media providing advice and seeking help and offering help and exchanging information. So that's extremely important. That's very important. That's a very critical role that social media are playing. And so we have to acknowledge that and not be very anxious to censor social media, because that is a temptation on the part of the governments all over the world, to blame social media. But it's very critical that we understand how these social media work and how to take advantage of the agility that social media provide. So in terms of misinformation itself, I think we know, our research has shown, and others have done this work, misinformation and disinformation both have significant consequences. It's just not about knowledge. We know that this influences people's attitudes and behaviors. So, for example, if everybody thinks, if people think that everybody else is not complying with guidelines, then that creates a kind of a normative belief that nobody is following the rules. Why should I follow? On the other hand, if people get that others are following the rules, then I also feel the compulsion to follow the rules. So it's very critical, I think. So there are but misinformation part is very critical, or correct information too. So there are two solutions to this. So one is at the institutional level. What I mean by that is, I'm not talking about the government, but institutions, such as Tata Memorial Hospital, and which has been doing incredible work, and a number of private hospitals and public hospitals and the frontline health workers in India. So the institutions have to take charge of and see how do you reconstruct their communications departments in providing that kind of a helpful information, the kind of information Dr. Pramesh talked about right now, and spread it far and wide, whether it is on depending on the platform. So there is an institutional issue here, and institutions have to really become much more agile than what has been the case, right? Usually communication departments use press releases and news releases, but I think you have, and some educational material, you have to really reconstitute the communication departments, and institutions can play a significant role, particularly institutions when you have a lot of credibility, such as Tata Hospital, Memorial Hospital, and others. I think it's very critical for the institutions to do that. There's also this, and I'll be happy to elaborate, but there is also this individual roles to play. I think, one of the things social media have done is everybody has become an information producer and a disseminator, right? It's not trained journalists who would sift the wheat from the chaff, so to speak, but anybody can become a disseminator of information or a producer of information. And my plea would be to think twice, thrice, 4 times before you forward something. I keep seeing these things, forwarded as received. Well, don't forward it even when you receive it, unless it is a credible source that is providing this information. So the lessons are fairly simple. I think, have a few trusted sources of information, and trust those sources, trust those sources to provide you that information. There is World Health Organization, the ministries, the hospitals, some organizations. Number one. Number two, double check it. Just because somebody has an MD, an MBBS, or whatever title they have and create a video doesn't mean they are providing reliable information. People may not be following peer-reviewed journals, and the science is evolving constantly. So that's one of the things. Don't believe everything you see just because it is on internet or it is on WhatsApp. Don't forward everything. Don't be finger happy, as we have said. Everything you see. And think twice before you believe everything, so there is this institutional solutions, but it's very, the last thing I want to say, at least for this moment, is the social media platforms are under tremendous pressure for the roles they have played intentionally and unintentionally in spreading misinformation, primarily because of the algorithms they have. Now they're very eager to work with governments and institutions. They're very eager to work. And the question is, how do we work with them, to really stem this spread of misinformation and spread good information to them? You cannot eliminate it completely, but you can certainly manage it and control it. And I think it's very critical to be completely, totally transparent at this stage. If people get a feeling that somebody is hiding something, that only breeds conspiracy theories, so it's very, very critical, and this is a lesson we have learned from public health emergencies, that you go out and provide complete, open, accurate information so that people can make these decisions.
Thank you so much for giving that balanced overview as far as, both the challenges and opportunities we have with social media. Coming back to Dr. Pramesh, as you can see, the chat box is quite active, and we've already started receiving a lot of queries, which I hope I can summarize in the second question that I have, which is that we've discussed home-based management, sir. But can you throw some light and take time to sort of elaborate on the latest protocols, latest recommendations for clinical management of COVID-19 in hospital settings? And of course, we would like to put out a disclaimer that these decisions should be made by clinicians in a hospital setting. But since we are in a position where families of patients are running around for that new drug in the market and everybody's concerned, so definitely there is some sort of decision making that even families are involved in. So from that context, if you could tell us about the major lines of therapies and treatment, and those which are grounded in evidence.
Thank you, Ananya. I think this is a great question, and something which is very, very relevant and topical today. So if you ask me why the health system is crumbling, there are many reasons. But what's creating extra pressure now is the fact that people are panicking. People are rushing to hospitals and getting themselves hospitalized when they don't need it. People are beginning to hoard oxygen when it really is not required. and they are taking medications which are not really indicated just for the sake of doing something. This attitude of trying to do something to treat a disease is something that we need to be very wary of. As I said earlier, most patients recover. This is a viral disease. That's something that we need to understand. It is not bacterial, it is not fungal. So most patients recover without very active treatment. The vast majority resolve completely with just paracetamol, rest, hydration, and if at all, a little touch of proning, which I'll come to a little later. One of the important things that you need to understand is that rather than start rushing for a hospital bed as soon as you get diagnosed with COVID, you should seriously consider the possibility of home care, because most of the patients would recover with just that. So what are the components of home care? It's very, very simple. Being a viral illness, it's self-limiting. It takes its course. There's very little you can do to influence the course of this disease. But simple measures like making sure that you're hydrated, taking paracetamol if you have body aches or fever is probably what will stand you in good stead in the initial phase. As I mentioned earlier, constant and regular monitoring of your temperature and your pulse is mandatory, as well as the 6-minute walk test. The pulse and the temperature and the oxygen saturation monitoring needs to be done 3 to 4 times a day, and the 6-minute walk test at least once a day, but preferably twice a day, once in the morning and once in the evening. If these show no alarm signs, you can continue to be treated at home with virtually no risk to yourself. The alarm bells, as I mentioned earlier, are when your saturation starts dropping. And if it drops, the first thing that you again need to do is to prone. By proning, what I mean is you lie in a face, chest, stomach down, back towards the ceiling kind of a position. So this single intervention actually improves your oxygen saturation by anywhere from 4 to 6% and improves the saturation levels. So for most people, this is all that's required. At this point, you would also consider taking an inhaled steroid. So there is a randomized trial which shows that inhaled budesonide reduces the need for hospitalization and reduces the conversion to severe disease. So this is a steroid, but this is not a systemic steroid. It is a local steroid, which you just use a puff, you inhale it twice a day, and the need for hospitalization reduces. In spite of this, if your saturation continues to remain low, that is, you're proning, you're taking your inhaled budesonide, you're doing everything else that's required, that's the time that you need to go in for medical help. Unfortunately, much before all of this, what is currently happening in the community is an over-prescription and an over-medication with multiple drugs. And this is something that we really need to guard against and be wary of, because none of them work and it's really of no use.
Thank you. Could you elaborate more on, I mean, we see a lot of questions on the role that antivirals, antibiotics, steroids. So can you sort of list some major lines of treatment and probably some basic science around how they work?
So currently we have a lot of good data that's come in over the last year. So if you had asked me this question 1 year back, the answer would have been, I don't know. And anybody's guess would have been as good as the other person's. But now, thanks to some very good trials which have been done worldwide, and I would single out the recovery trial for the sheer magnitude of what it's achieved and the scope of the trial, which has answered so many questions which are important to COVID care. So currently, the only proven drug which is effective in COVID care is dexamethasone, which is steroids. But having said that, I will qualify that you divide COVID disease into mild, moderate, and severe. Moderate and severe being that you require oxygen in some form, either inhaled oxygen in the form of oxygen concentrators, oxygen supplementation, or in severe cases with ventilation. These are the only subsets in which steroids help. There is actually a trend towards worsened outcomes with the use of steroids if used very early. So if you're in a situation where you don't require oxygen to maintain your saturation and you take steroids, you're actually doing yourself harm. There is no role for antibiotics. No antibiotic works unless there is secondary bacterial pneumonia that has been shown, or you're very certain that it is not just the viral component that is causing the fever. There are a whole host of other drugs, ivermectin, hydroxychloroquine, several others which have been tried, continue to be tried, vitamin C, zinc, plasma, none of which work. And we are actually wasting our time and our resources trying to find these drugs, favipiravir, none of them work. So rather than waste your time looking for all of these, I would suggest sticking to the basics and using paracetamol, hydration, proning as your, and if at all required, oxygen as your prime lines of defense. The only other drug that's been shown to work is oxygen. So I would really strongly advise against wasting your time looking for all of these other drugs attempting at cure.
Thank you, sir. So as you said, over medication and over prescription may not necessarily be the right treatment. So coming back to Professor Viswanath, we've discussed the pharmaceutical interventions and clinical management, but we know that, as Dr. Pramesh just mentioned, that the majority of patients, would not need clinical or hospital-based care. So, in this context, and given the unforeseen emergency that India finds itself in with the second wave, can you tell us about some of the key public health mitigation strategies or non-pharmaceutical interventions that you think can be implemented or scaled up in India in the immediate or the short term to mitigate the pandemic?
Sure, thank you for that question. I could listen to Dr. Pramesh's answer forever. I think it is so on the point in terms of overtreatment and mistreatment and people's anxiety. But it's perfectly understandable why people are anxious, because because of the dire nature of the disease. But even if you say you had 20 million cases in India, there are still 1 billion people, or 1 billion and more people who have not contracted the disease. So it's very critical. What can we do before they end up sick, right? And there is a lot we can do from a classic public health mitigation measures to prevent this disease in the first place and stop the spread. And here, I think, social norms play a very critical role. And classic public health measures include, for example, encouraging people, wearing face masks and or cloth, whatever the cloth covering, over their nose, both as a source and a source of control, as well as for protection. And they can do this with, this is in their hands. They don't have to go to a hospital or anywhere else to do this. They can do it on their own at home or with people, and it has to be done in combination with other measures. Physical distancing is absolutely critical. Again, it is in people's hands. Hand washing, using reliable sources of information for taking care of themselves, of their family, both physically, mentally, and socially. It's very important to do that. And then there are these community-wide mitigation measures, and the impact of either introducing them or lifting them. I think when there is a curfew, when there is a lockdown, it's very critical, I think, to comply with it, because again, it is in your hands whether you comply or not. It's not always about the presence of police or somebody else coercing you, but it's very much in their hands, right? And then there are, of course, the screening strategies that, to detect infected people that Dr. Pramesh started talking about, the tests that can be done when they are available, and taking actions based on those tests, but other measures, are very relevant. One of the things that people keep, that often is forgotten in this, make people a part of the solution, right? It's just not on government. It's just not on the doctors. It's just not on hospitals or NGOs. It is on the people. You have to make them a part of the solution, which means, really creating and generating those norms that people are modeling good behavior, and promoting that good behavior. Because there is this impression from the coverage right now that everybody's non-compliant and nobody can do anything. And that is wrong. I think people are complying, and it's very critical to have that good role models and following these measures so that you don't have to end up in the hospital in the first place.
Thank you so much. As you said, making people part of the solution itself sounds very motivating. So coming back to Dr. Pramesh, we spoke about what works. And as you can see in the chat box, and I'll try my best to frame this question appropriately, which is to say that what are your thoughts on some of the therapies that are being widely prescribed for management of COVID-19? They find themselves in all the major WhatsApp groups. They find themselves on Twitter, SOS help that we get. And not to say that it is intentional, but a lot of people without knowing the science behind it are actually running pillar to post for a lot many therapies, which the scientists, the practitioners would know that has little or no or inconclusive scientific evidence. So can you tell us, or possibly, and we see a lot of questions about, and some of them may have partial evidence. We see a lot of questions around, say, plasma therapy. I'll just use one example and stop there. That does plasma therapy work? We all get that WhatsApp message in the morning, please arrange plasma for my friend and relative. So does it work? If it doesn't work, why? I mean, what can be done about it? And then I'll come to you, Dr. Vish, in terms of how do we communicate about therapies which seem to work but may not have science backing with it.
Yeah, thank you, Ananya. That's a really great question, and I think that's something that many of us are plagued with day in and day out. So I don't want to stop just with plasma, because it's only one of those treatments which are being abused. There are several others. So as I mentioned earlier on, for early disease, a very frequent masala prescription that you get is vitamin C, zinc, vitamin D, ivermectin, hydroxychloroquine, favipiravir. Let me just start off with saying that none of this work, and I don't think we should be wasting our time, money, and effort on any of these. When it comes to some other treatments like remdesivir, tocilizumab, and plasma, I'll be a little more nuanced. I don't think there's an absolute answer to this. In most patients, they don't work. There's a very, very, very small group of patients in which these drugs work, but unfortunately, the overuse is so rampant that I'm very tempted to just say it doesn't work in any patient, but that's not being scientifically accurate. If you want to be scientifically accurate, there are situations where they work. For example, for remdesivir, it is when in the very early phase of when patients start requiring oxygen for therapy, there is a marginal, and I say marginal because it's just a 3 to 4% benefit when it comes to the use of remdesivir over doing everything else. Frequently, remdesivir is used in very early disease, in mild disease when people are not on oxygen. It's very frequently used when patients are on a ventilator, and both these extremes are situations where remdesivir is as good as plain water. Let's go to tocilizumab. Tocilizumab is probably one of the scarcest drugs that are available in the Indian pharmaceutical market today. It's being sold at 3 to 4 times. The cost of tocilizumab, which is approximately 30,000 rupees, is now being sold in the black market for 1.2 lakhs. And again, this is a very, very, very small, just 1 to 2% of patients who actually benefit from tocilizumab. And this is the subgroup of patients who rapidly require very high doses of oxygen. So, which means that you start someone on oxygen and they start requiring rapidly increasing requirements that this benefits. And again, it's just one dose, if at all it's given. So in most cases, 98, 99% of patients, it just doesn't help. Convalescent plasma has probably the least evidence to support it. And I won't emphasize this, I can't emphasize this enough, because very often family members, relatives spend hours together trying to identify patients who are capable of donating plasma and help their patients. Again, this is useful only in early disease. The desperate cries for help that you get when patients are on ventilator, when they're in the ICU, is absolutely a waste of time. The only evidence for convalescent plasma comes in early disease, where you have a donor with a very high antibody titer. Now, in a situation where you have 400,000 people getting infected with COVID-19 every day, and you try to find 400,000 people with high enough antibody titers that you can administer at a cost which is cost effective, it's like hunting for a needle in a haystack. So I would rather concentrate my energies on sticking to the basics, making sure that you get the basic medical care that is required to help you survive this disease, rather than hunt for anybody with plasma. So again, just going on to add that this is a result of two factors. One, physicians who are trigger happy in prescribing these medications, and two, pressure from patients who assume that a doctor or a physician who's prescribing them just physiotherapy for the chest, paracetamol, and hydration is not doing enough for their patient. I think both these sides need to push back a little bit and ensure that we give patients the right care that they deserve.
Thank you. As you rightly mentioned, the other side, the pressure bit, the demand side, and as you know, Dr. Vish, a lot has to do with how we communicate that. So suppose we hear this in this webinar today from Dr. Pramesh, let's say plasma does not work. I mean, how do you communicate that? And could you give us some of those strategies?
Yeah. Right. So, if you go back actually, this is being recorded. So the first 3-4 points that Dr. Pramesh made, what you should do in case you are feeling ill, captures it so well, right? Within maybe 2 minutes, he has provided the answer of, which is very simple, straightforward, nothing complicated, nothing nuanced. It's just do A, B, C, and D, etc. Right? So, but the problem is this tremendous misinformation and disinformation that is spreading out there. So take hydroxychloroquine as one example, and unfortunately, we in the US have contributed to the mainstreaming of that disinformation through our former president, talking about it. I think, so why do people follow this, right? So it's a simple question. So why do people follow this disinformation? I think, that's partly because there is an information gap. People are trying to make sense of this very complicated situation, and they're scared. And there's a lot of uncertainty when you're scared. The science is changing all the time because we have a better understanding of COVID-19 today than we had 2 months ago, 3 months ago, or last year. And they have to cope with this fear. They have to cope with this uncertainty. There is a sense of vulnerability, that people are feeling, and some are feeling invulnerable. Nothing will happen to me, and then there is a group of people who are very complacent, right? So these are the reasons, fear, uncertainty, perceptions of both vulnerability and invulnerability, and complacency. Nothing will happen to me. Why do I care? Kind of a thing. And this sort of a gap in information is what driving and compelling people to make sense of it. And that's the reason they ask a friend, they ask a family member, and they hear about it, and they say, oh, let's go with plasma. Let's go with something very complicated. So I think the challenge for us is, to continue to communicate with people that, this is not complicated. It's a complicated science, and you are not the person to make the scientific clinical decisions. Let's leave the decisions to clinically trained scientists and clinically trained physicians who will keep up with the science, right? It's not your job to keep up with the science. You have to take care of yourself and your family. And here is the information you need to make the decision today, in a very simple way. I think that's the key here. How do you as an individual ignore this noise, separate it from the signal, and say, what are the 3-4 things you need to take in a public health way? And I said, I cannot repeat this enough to say face masking, not meeting other people, physical distancing. Somebody in the chat room asked ventilation. It's a very important issue. In fact, we will have a webinar, I think in the next week, 10 days or now, exactly on this issue. Ventilation, you don't have to have complicated, opening the window, putting up a fan there, taking care of yourself on very simple things Dr. Pramesh mentioned the basics. In cricket and baseball, we talk about fundamentals of the game. You have to be able to pitch properly. You have to be able to hit properly. You have to be able to field properly. That's all it takes. It's not rocket science. It's the same thing here. The fundamentals are, from a public health perspective, comply with lockdown curfew guidelines, maintain physical distancing, face masking, ventilation, hygiene, and that can prevent, you can actually stem the spread of the disease, and flatten the curve, so that people like Dr. Pramesh or Dr. Sonali Ved and others can do their job in terms of treating people, and not get overwhelmed with this.
Thank you. So let's continue on that thread. We've discussed home-based management. We've discussed clinical management. Coming to the question of vaccines. Dr. Vish, as you just mentioned, all of this health information plays a big role in the day-to-day decisions that we make for our own selves and for our families. So when we talk about vaccines, in this regard, there's a very, very common query that we've come across. In fact, we came across this query in the WhatsApp group of the Harvard Club of India, that, given there's been a lot of media coverage on people getting infected with COVID-19 despite getting a vaccine jab. And in some cases, this has further sort of discouraged people to trust in the efficacy of the vaccines. So in this regard, what do you think can be the role of strategic public health communication to translate the messages around what vaccines can do and cannot do, when we talk about reinfection? How do we communicate that?
Right. Yeah, so I get asked this question a lot, both in my role on different committees as well as a public communication perspective. So I will leave the clinical part to Dr. Pramesh. He can answer much more authoritatively on why are people still getting sick even after vaccination. But I urge people, number one, there is a great system in place. In general, there is a regulatory system in place, and vaccines are not approved overnight just because people like them, right? The regulatory system looks at the data closely and then approves, whether the vaccination is for general administration or not. And number two, anecdotes is not evidence. Just because you have a collection of anecdotes doesn't an evidence make. Just because you hear a story, I just was talking to somebody yesterday about it, and she kept telling me, but Vish, I know somebody who went to the hospital after getting a vaccination. It could be any number of reasons why somebody ended up in a hospital because they got vaccinated. They may have other problems, they might have just got vaccinated, or it may be nothing to do with the vaccines. Just, so collection of anecdotes do not make an evidence. Number three, this is somewhat a nuanced issue, but it's very important for people to know. Correlation is not causation. What we mean by that is just because two events occur simultaneously or in close proximity to each other doesn't mean they are related to each other, right? I might get sick because of something else, because I have diabetes, but I also got a vaccine. So I cannot attribute my vaccine or vaccination to the diabetes problem, right? Those are two different problems, I think. And it's important for reporters also to get this right. Just because these two are occurring simultaneously or in a close proximity doesn't mean they are causing each other, I think. And people hear a lot about efficacy rates, effectiveness rates. And I always say this, don't worry about it, because we have unintentionally, we collectively on our side, those of us who are in public health, clinical health, have unintentionally created this impression that efficacy rate matters in terms of the numbers you state are the real numbers. There is a huge difference between what an efficacy rate is, what an effectiveness rate is, how these are calculated, under what conditions they are calculated. These are all numbers that are calculated as a part of clinical trial, So we unintentionally create this hierarchy of vaccine efficacy numbers, and people are now faced finding, or what we call as raifying, making these efficacy numbers real. Don't worry about it. If a vaccine has been recommended in general, for the most part, it is, effective in preventing you from getting sick. If you do get sick, for the most part, it will reduce the seriousness of the disease and reduce hospitalization. And there are cases where you could get seriously ill, but for the most part, it will help you. It will protect you. That's all you need to know. And there is a very good system in place globally in many countries. If there is even a slight detection of a problem, it's being monitored. It's being talked about. It's being closely looked at, as we have seen with AstraZeneca, as we have seen with Johnson & Johnson, Janssen, as we have seen with others. So I would just make sure that I don't get too bogged down on these efficacy numbers, etc. If the vaccine is available, take it and get it done. The last point I want to say before I say anything else, there is also this impression that most people are not getting vaccines. In fact, the fact is most people are getting vaccines. Getting vaccination is a social norm, right? Most people are getting it. So, and that's important for people to know. Otherwise, there is this impression that, nobody is getting it, therefore I shouldn't get it. Actually, most people are getting it. You also go get it. There is a small group that is resisting it, and we can address that.
Yes, Dr. Pramesh.
Sonali, I think that was a great response by Vish, and just wanted to add a couple of medical points to it. What he said is absolutely spot on. We know that all the vaccines that have been approved work, and they've been through very rigorous randomized trials to show that they work. Efficacy is in the range of 60% to 95%. So what do you mean by efficacy? Efficacy means that it's either preventing you from getting the disease, or as Vish said, even if you get the disease, the chances of your developing a serious illness or death is much lower. So what's the minimum benefit that it gives? Amongst all the vaccines that we have a 70% reduction of the chance of ever getting the infection, and a 95% chance of getting serious infection, and a 98% chance, lower chance of dying of the disease. So let's not look at that ideal 100% safety, 0% risk, which is utopian. You don't have a single intervention in medical history which has that kind of data. Let's look at the remarkable way science has progressed in the last one and a quarter years. The average time it takes to develop a vaccine is 10 to 15 years. We've achieved this remarkable feat of doing this within a few months, and we know we have strong data to support the fact that these work. So rather than debate the nuances of is the Pfizer or the Moderna better than the Covaxin or the Covishield, which is a moot point in any case, because what you get is what you get. Rather than waste your time on all of that, what I would urge every single one of you is just go get vaccinated, because that is probably the only thing besides the universal precautions of masking, physical distancing, and hand hygiene, which is going to save you from this pandemic. Virtually no other medical intervention is going to have as much benefit as vaccination does. And let us forget about this vaccine hesitance. We don't hesitate before we give our kids oral polio drops. We don't hesitate before we give them their DPT shots. Why are we so paranoid about taking a COVID vaccine shot when it has so conclusively been shown to have far more benefits than the risk? So if there is one message that I want, actually two messages that I want to get out of this session, it is follow universal precautions. Masking at all times when you are in public places. Make sure that you physically distance as to the extent possible, 6 feet if possible, or at least 3 feet if 6 feet is not feasible, and hand hygiene. That's the first point. And the second is get yourself vaccinated at the first opportunity that you have. And these probably will do much more to flatten the curve and reduce disease transmission than any other message can.
Thank you, Dr. Pramesh. So we'll pick up from that message that you gave that, probably the single biggest public health intervention which can be effective in flattening the curve is for all of us to go and get the vaccine. So putting it in the perspective of the second wave of COVID-19. For a lot many people, vaccination only opened on the 1st of May, and some of them were in the middle of their first or second doses, and some of us are not vaccinated at all as yet. And in the middle of this, if we do tend to get COVID, and now we are recovered, I think everybody wants to know how soon after I have recovered from COVID-19 should I go for my first dose. And then there is also a qualifying question that if I was in the middle of my 2 doses, how long should I wait before I get my second shot?
Thank you, Ananya. I'm going to, before answering that question, make a very, very unpopular statement. I think we needed to prioritize the vulnerable first. And when we have not covered such a large proportion of the over 45s and the ones with comorbidities, I think we are kind of jumping the gun by prioritizing or vaccinating the 18 to 45s. I know the vast majority of this audience is probably between 18 and 45, and that's the reason I said this is likely an unpopular opinion. But if you want to look at it from a public health perspective, whom do you want to protect the most? The ones who are most vulnerable and the ones who are most likely to have serious consequences of the disease. Now, I know what the first argument to that is going to be. You're going to have a lot of questions on the chat and the Q&A session saying, but I know this 33-year-old person who actually died of the disease. I know this 41-year-old person with no comorbidities who died of the disease. But when you look at a public health from a public health perspective, you don't look at individuals anymore. You look at it, what is the larger social good? What is the larger population-based good? And clearly we know that the mortality is much higher in those above the age of 60, those with comorbidities, and if you want to lower it a little more, above the age of 45 and those with comorbidities. So I think the priority has to remain that we vaccinate these vulnerable first. Coming to your question about what's the timing of vaccination when you've already had a COVID infection. The CDC guidelines actually suggest that you can have the COVID vaccine as soon as you recover from the disease, which means that for most people, it's between 10 to 14 days of having been diagnosed with the disease. Most people recover from the disease within that time, and you're safe to take this. But I think we are being a lot more conservative in India, and most recommendations here suggest that you wait for between 4 to 6 weeks after you have recovered from the disease, which I think is a bit of an overkill. But I wouldn't argue too strongly with that, because if you've already had COVID, it means that you've already developed some level of antibodies which will protect you against an immediate infection, and probably delaying your second dose or your first dose for 4 to 6 weeks after you've recovered is not going to be a disaster. But if you want the science behind it, you can take it as soon as you've recovered from the disease.
Thank you. And very quickly, as we come towards the end of this moderated discussion, to Dr. Vish, I mean, we are talking over a Zoom webinar, and we are talking about WhatsApp forwards and Twitter hashtags. So again, now moving the context, while digital communication, as we all know, is indeed the most popular platform for sharing of health information, how can we ensure a more equitable approach towards science communication? And this is especially when we look through the lens of community well-being. And I mean, what do we do when we are thinking and talking and trying to work for people who may not have access to smartphones and regular internet? How do we get the health information out there?
Right. So when Dr. Pramesh started talking about vulnerable people, vulnerability can be somewhat broadly defined from my perspective, right? So certainly I think there are this group of high-risk individuals over a certain age, and they're particularly susceptible, and he's absolutely correct that we take care of the vaccination there first, and the evidence is very clear globally on that. But vulnerability also comes in many different forms, right? In terms of social class, in terms of being in rural areas. You know, one of the things that has been very frustrating to me sitting here is I don't know what's happening in rural India, you know, and how people are coping with it. Vulnerability will also come from what we call as communication inequalities, which is, you know, not get access to these kinds of technology services In many ways, somebody asked this question also on a webinar. We are on a social media platform. We are on Twitter. We are on YouTube. But not all real people are on Twitter and YouTube, or they are, especially Twitter, right? So we are on Twitter, but not everybody else is. So what we say is, number one, segment your audience. The marketers do this all the time, right? Why can't we do it in public health and public health communications? Segment your audience, find out where these vulnerable groups are, whether it is place, whether it is class, whether it is caste or tribe or geography, whatever it is. Find out where they are, and we know where they are, and strategically customize messages for them in local languages. We are all speaking in English. This is great, because it's a medium of communications for technical languages. But there are a lot of people who don't necessarily speak in English. India is extremely rich in a variety of languages. We have to make efforts to translate this material in local languages. We have to really convert our communications into ways that people can consume where they are. Let me give you one example, which is also being done in India. So in the communities we are working with in the US, because of food insecurity issues, what we mean by food insecurity is that people don't have sufficient food to eat because of job losses. There are food pantries in the community, so where they can go and actually pick up groceries. So our community partners took all the infographics we are producing, we printed it out for them, and when they're handing out these weekly groceries, they put a sheet in it and hand that over on how to take care of themselves, right? So there are ways to think about it. India has an extremely rich, competent history of communications in public health. You take the Pulse Polio campaign, right? So there are a lot of success stories. So we can draw from those success stories and tailor and customize our messages accordingly, to these groups where there is socially vulnerable, not just in other ways.
Thank you, Dr. Vish. Shonali, over to you. Can you request you to please take over the live Q&A, given all the great response that we've had. Thank you so much.
Thank you so much, Ananya. So I think a lot of the questions have been covered, and the panelists have also been answering in the Q&A panel. So I'd request the audience to check the answered questions there. And the panelists are also replying in the chat box itself. My first question is to Dr. Pramesh. What is the role of CT scans for COVID? We see a lot of people getting anxious when they read their CT scores. And then what is the risk of radiation? Who should get a CT at what stage?
Thank you, Sonali. That's a very important question, again relevant because like stock marketers used to discuss the Sensex earlier, people are discussing CT scores now. And the short answer to your question is that there's virtually no evidence to suggest that CT scores have anything to do with your managing your treatment. All that it does is to try and quantify how much of your lung is involved. But if you had a discrepancy between your CT score and your clinical picture, I would go by clinical picture any day, because clinical picture reflects a much more real-time situation than a CT scan ever can. So if you were to look at CT scan pictures of people who tested COVID positive 2 months earlier, they would still retain some of the sequelae of the previous infection. So it virtually means nothing except that it gives you a little bit of an a little bit of a indication about how the disease is likely to be. But going to treat based on CT scores is virtually completely non-evidence based. It has no role in routine practice, and certainly no role in mild and moderate disease. It's only when it comes to severe disease that you want to intervene by way of some medication that it actually has some role. And again, that's a very, very limited role that it actually functions. I even see people monitoring progress of disease using CT scans. So someone comes to me with a scan which says, I had a score of 4/25 earlier, and now it's become 7/25. So should I be worried and get myself hospitalized? So it's it's a moot point that most people with a score less than 19 have virtually nothing to worry about. They'll get away with virtually being treated at home with home-based care. And just this score gives them a number to quantify their disease, and which is virtually medically meaningless. And it's creating a lot of panic and actually influencing care where there is virtually no evidence to support it.
We are also seeing the same thing about the CT value on Rt Pcr tests.
Again, something which is a misnomer, because what it shows is the cyclic threshold of the Rt Pcr test shows the viral load. So while it might intuitively seem that if you have a high viral load, you will have more severe disease and more infectious capability, and to some extent that's true, it virtually again does nothing to dictate the course of the disease. And again, going by those CT values and getting panicky about low CT values and being complacent about high CT values again really doesn't make sense. We just can't. One thing this pandemic has shown us is that we just cannot get away from the basics of medical care, which is go by clinical grounds, do the minimum possible, and the fundamental principle by which a physician signs to primum non nocere, which means first do no harm. And unfortunately, a consequence of much of the interventions that we've been doing as part of the COVID pandemic is actually causing harm.
Right, thank you. Dr. Vish, could you talk about the role of how do we communicate about ventilation? It's been missing from the public discourse. We've known this since last year. And now there are all sorts of fears that, oh, airborne means that anybody can get it anywhere. It's like a miasma. And why is the slogan "Do Gaj Ki Duri"? Why don't we still have a slogan which says "Khirki Kholo"?
Right. I think that's an excellent point. Actually, for whatever reason, as a public health strategy, we have ignored the importance of ventilation. And number one. Number two, we have also communicated in a way, even when we talked about it, that it's somehow complex. It has to have a very complicated instrumentation, that can be available only in fancy buildings, fancy houses, or fancy hospitals. And I think, it's a huge, public health has, when we go back and do some after action reports, I think one of the challenges, one of the things we will realize is the failure of public health in communications too, I think in some ways, and ventilation is a good example of that. So Dr. Vaid, I will leave the technical part for a webinar we are doing next week, where we will actually have an expert, Harvard expert on ventilation, come and give a talk on how to do this, technically in any kind of a dwelling or a place. But it's absolutely correct. Ventilation is important, but you won't, just because you're opening your window and letting air flow in and out doesn't mean you're contracting the disease. It still goes back to the original statements we made, which is wearing your face mask and maintaining that physical distance, ideally and optimally those 2 meters, and not everybody lives in settings that 2 meters is possible, but at least a meter, and making sure that you're following those simple principles. Just because you open the window, just because you're touching surfaces, right? Early on, we used to say, clean every surface you have, clean your groceries, clean everything. Now we know that evidence has changed, evidence has evolved, and I would say ventilation is one part of it. Just because you're opening a window or your door and putting a fan there for air to circulate, very simple measure, right? Doesn't mean that you will catch the disease.
I'll just add to that, Sonali. I think Vish was spot on with this. But just to add to that, there's a lot of concern about people going out for walks, going out to gardens, being out in open air, children playing in gardens. I think we are depriving them of something that's so very important for their mental and emotional well-being. And these are some of the safest things to do when you're out in the open in well-ventilated areas where physical distancing is far more easy than what it would otherwise be in schools or hospitals or movie theaters or swimming pools. I think we are missing a bit here. We are depriving people of the pleasures, simple pleasures of life, like going out for a walk, going out for a jog, spending time in the garden, taking your dog out for a walk. And these are perfectly safe things to do. So I think I would actively encourage people to do that in areas where they are permitted to by the law.
Right. Just to add on to that, I think one of the things that does worry me, and Dr. Pramesh, I'm glad you raised that issue. One of the things that does worry me is that we have communicated unintentionally, I think, that people cannot do anything except wait to get sick and then end up in a hospital. There's a lot that is in their hands. So we talked about the public health part of it, the physical part of it, but taking care of this, what the classic World Health Organization definition, right? Health is just not an absence of disease, but it's about physical well-being, social well-being, and mental well-being. And India is so rich in these traditions, doing meditation. You don't need complicated equipment, expensive equipment to do this, right? Taking care of, forgiving yourself and taking care of not feeling guilty and taking care of yourself physically and mentally is extremely important, and that is within your hands. You don't need expensive propositions, right? Expensive ways of going into fancy places or gyms. You can these are in your hands. You can do that.
Thank you so much. Dr. Pramesh, we're getting these scary WhatsApp messages about black fungus. Is this something to be concerned about? How can it be avoided? Is the incidence really high, or is it a rare event?
So the honest answer to that is we don't know. I don't think there is adequate reporting, mandatory reporting of this complication for us to be certain. But all that we can do now is to see. So one fundamental thing that we need to understand is every decision in life is risk versus benefit. And we need to weigh the risks versus the benefit of giving steroids, which is why I kept emphasizing that in early disease, mild disease, where there is no requirement of oxygen, steroids should be avoided. Why does mucormycosis happen? Because it's overuse of steroids, or in some way creating an immunosuppressed state, which is causing the fungus to grow. And while you could debate about whether to give steroids or not, we know for a fact that the hardest endpoint of all, which is mortality. I mean, you can't fudge mortality data. The mortality data is in favor of steroids for moderate to severe disease. The mortality data is against the use of steroids in early or mild disease. And that's all that we have strong data on, and that's what we should guide our decisions on. Avoid steroids in early or mild disease where you don't require oxygen to support your saturation. And please use steroids in situations where it's required for moderate and severe disease. I saw another question on the chat which said, in patients with diabetes, how do you handle it? We know the strong benefits of giving steroids in patients with moderate to severe disease. Diabetes is much easier to control than the inflammatory response that you see with COVID-19. So given the risks and benefits of giving or not giving steroids, I would err on giving steroids and controlling the diabetes with whatever it takes, whether it be insulin, oral hypoglycemics, whatever it takes, but to continue giving steroids for moderate to severe disease. But most importantly, don't overdo it by giving steroids in early disease. Don't self-medicate would be my first recommendation.
I'm going to take a clinical question because somebody's asked it for their wife. My wife is an asthma patient. Baseline oxygen was between 87 and 93. Do I need to bring it up to 95? We have a concentrator. I'm assuming she has COVID now. So what does baseline, this could be in smokers and COPD also. So people with low baseline values, what should they be doing?
Right. So I did answer that question in a private response because I didn't want medical advice to be given on a public forum. But nevertheless, I wouldn't change your goal post because you've got COVID. And I don't even think the gentleman's wife has COVID. I probably think he's asking this just to be prepared. And that's a great point. I mean, being prepared is extremely important. To all of you, please buy a thermometer, please buy a pulse oximeter and keep it at home because it helps you monitor your disease. But coming back to this question on asthma, you don't need to change your goalpost. If the baseline saturation has remained at that point, I would be happy if after COVID it remained at that point. We don't have strong data to suggest that it would let someone with a baseline saturation of 87 go right up to 70 before you hospitalize. But if it goes below what the normal baseline saturation is, below 87, I would be worried and try and get oxygen supplementation.
Thank you. This is for Dr. Vish. So right now we are focused on ramping up infrastructure, oxygen, and other care for COVID patients. how can we at the same time mobilize resources and attention for institutionalizing COVID appropriate behavior so that we can continue to contain and mitigate the epidemic? What role can public, private, and community stakeholders play?
Right. I think my original statement, or the first statement I made, I don't think anything we say is original here, but the first statement I made, that you have to make people a part of the solution, still applies here. I think the reason is when in my conversations and my presentations, and I often hear about, should I blame the government? Should I blame the hospitals? Should I blame my doctors? And my response to that has been, all of us have a role to play in this. Each of us has a role to play in this. And as I said earlier, what is the key in managing public health emergencies from an institutional perspective? Transparency, credibility, and trust, right? These are really key, fundamental. You cannot put everybody in a jail if they're not complaining. You just can't do that. We have 300 million people in this country, billion people in India. You can't police your way out of this crisis. That coercion doesn't work. It's persuasion. So it's very critical that at every level, the federal government, the central government in India, we call federal here, the state governments have to have a communication plan. You have to go out and communicate every day. One of the best examples I give is what happened during H1N1, when then director of the CDC, Rick Besser, went out and communicated every day. What did we know about the disease today? What did we not know about it? And what is being done about it? And being honest, being transparent. That's one thing that's absolutely essential, because the moment people think you are not being transparent, you're losing your trust and credibility. That's one, I think. And then institutions have to promote this. As I said, our communications is 17th century or 16th century. We really need to do it. There are multiple groups with multiple issues, and we really need to become much more agile in the way we design our communication campaigns and provide, customize those messages in local languages to different groups with social vulnerabilities. So the institutions have to do it. And this has to be a public-private partnership, right? It doesn't, the responsibility is not out there with one institution. And that means, all of us, who have the good fortune of receiving this education, being a part of the institutions globally and locally, to be a part of it. The last thing I want to say is, I think there's a tremendous amount of goodwill for India and right now to help India. The question is, how do we do this? They're well-meaning people, but not all of it is helpful, when we overwhelm you with these things. And so I think there has to be a strategic plan while you're doing this in emergencies to how to really communicate this information as an entity, coordination. You can't control it, but you can coordinate it.
So I thank you so much. So I'm not sure if we've covered this, but people are worried about catching the infection when going for vaccination. How do we address that given the high rates? Whoever would like to take that, because it's both clinical and a communication issue.
Yeah, so I'll take a first crack at that, and maybe Vish can pitch in later. So this is a real fear. I think some vaccination centers are getting a bit crowded, and we need to understand that these areas are potential sources where you could get infected from each other. So I would urge all vaccination centers to ensure that there is adequate physical distancing. That's by far the single most important thing that you need to do, and ensure that everyone who comes in for a vaccine comes in with appropriately worn mask. Again, it's not rocket science. It's just sticking to the basics. But I would urge caution on both sides, both on the part of the vaccination centers, to ensure that whatever facilities that they do does enable this kind of behavior, and for those who go for the vaccination also to make sure that they're disciplined in how they approach it.
Thank you so much, Dr. Pramesh. And I think with that, we'll come to an end of the Q&A session. Many thanks to everybody for their questions. We apologize. We've not been able to get to all of them. We'll continue the webinar series, and hopefully in future webinars, we will be able to answer your questions. I'll hand over to Dr. Abha for key takeaways and for concluding this session. Thank you very much.
Thank you so much, Sonali. Thank you very much. I'll just try my best to summarize what we have been hearing. And Dr. Pramesh and Dr. Vish, please tell me if I've recorded this incorrectly or you would like to suggest anything that I have missed. So in fact, I was first trying to note down points that Dr. Pramesh was saying, and then I found that all of it actually fitted into a very useful communication material that he's already created. I want to direct all of you to please use it widely. It's been translated in 20 Indian languages, and I'm hearing latest that it's going to get translated in Tibetan as well. A key summary, a very simple message that Dr. Pramesh said is, please do not panic. 98% people really get well without having any kind of complication, and probably it's a much larger proportion who are getting better because we're having a lot of asymptomatic people who are not currently being documented as part of the denominator. If you feel you have symptoms of COVID, which includes fever, sore throat, cough, breathing difficulty, the most important thing is stay calm, take a paracetamol if you're having fever, ensure that you're well hydrated, and most importantly, please monitor yourself. Please get a pulse oximeter and monitor yourself. You can monitor it 3 to 4 times a day. Dr. Pramesh mentioned very nicely, you can do a 6-minute walk. So do your pulse oximeter reading at a baseline. And then after a 6-minute walk, you can again repeat your saturation. If your saturations are more than 94%, you really don't need to do anything. If your saturations are less than 94%, then that is an alarm bell. You need to consult a doctor. You need to find out. But Dr. Pramesh very clearly said that above 92%, we do not need to give oxygen. So if your saturation is between 92 to 94, your first step should be to do proning. That will make a difference to most of the people. You can also have a budesonide nebulization twice a day. That would also be helpful. But if saturations are less than 92%, then you will need oxygen and you will probably need steroids. Very, very clear and important message from Dr. Pramesh. Do not start steroids if you're not having low saturations. Steroids can be detrimental, especially if not monitored. And in fact, there is no efficacy. And it was shown to be detrimental in the trial that Dr. Pramesh mentioned when it was given to the population which did not have oxygen requirement. Another very simple, important point he made, which I see all the time as a practicing clinician. Lots of cocktail of medicines, hydroxychloroquine, ivermectin, doxycycline, vitamin C. And it's so hard to tell the patients when it's been prescribed by other doctors that really this is not going to make a difference. This is a virus, it's self-limiting. If you do not have a complication, you're just going to have a course of 5 to 10 days of illness and it's going to resolve. The most important thing is that you need to monitor because the line of treatment changes if your saturation drops. A very clear message that plasma therapy, there is no evidence that plasma therapy works. There is a nuanced message that remdesivir and tocilizumab is useful in a small percentage of patients. These are medicines that need to be given in a hospital under supervision. But by far, the medicine that we mentioned, that oxygen and steroids. And of course, one thing that we didn't bring in the discussion is to have an anticoagulant if a person is having requirement for oxygen. There was a very fantastic discussion on the COVID vaccine. So it was like, don't worry about the efficacy. Of course, it ranges between 60 to 90%, but please get the vaccine that you're being offered. The advantages of the vaccine are huge. There is a 70% less chance that you will actually get the infection. If you do get the infection, there is a 90% less chance of a severe illness and a 98% less chance of actual mortality happening. So it is one very important intervention, which is saving life. A very important point again from Dr. Pramesh, which is contrary to the current government policy, is that COVID, we need to really prioritize people who will have the greatest marginal benefit if they're given the vaccine. And this is the age group more than 45 years, as well as those with comorbidities. We were asked that how soon after we recover from COVID can we get the vaccine? So the CDC guidance is about 10 to 14 days after you recover. The current Indian guidance is 4 to 6 weeks. There wasn't a very strong view on whichever you would take, because you would have about, for at least the next 90 days, some amount of immunity from a reinfection if you have a COVID infection. Dr. Vish spoke so comprehensively about the miscommunication and misinformation that we see all around us. And he brought out a very important point that first and foremost, it's really very important that institutions that we trust come out with helpful information and spread it widely. We really need credible institutions to come forward and give information that reassures us, and we can then sort of ignore the noise that he said, which is all around us in social media with friends and family. He also said that individuals, and I myself, while listening to him, was thinking that how often I may have forwarded some of the messages that we see on social media. It is our responsibility as individuals to make sure that we are sharing information that has been validated and we believe it to be credible and we have checked the source of it. He said social media can be a great strength that we can harness to spread good information, but we need to be cautious that we are not miscommunicating and misinforming. He emphasized so well that we need to send this most important credible message out again to the public, and we need leaders actually to model, as well as individuals in the community to model good behaviors with hand washing, social distancing, compliance to lockdowns. Policing is not going to work. It didn't work before. It's not going to work now, and especially not when the pandemic is all around us. Test and trace. Dr. Pramesh had also mentioned very importantly, if you have access to a test, please do test. Otherwise, you can also syndromically understand what the clinical features are and even start management before you get your test done. And most important message from Dr. Vish is make people part of the solution. Find good role models and have them emulate that. There was also a discussion on why do people follow misinformation. I find myself also sometimes confused with all the media messages around. And he very rightly said, we're in a very uncertain situation. Some feel very vulnerable. Some think that nothing's going to happen. They're complacent and they feel they're invulnerable. And it's hard to ignore the noise that is around. But what we need to do is comply with the simple things that we said earlier, things that are in our control, and really leave the medical decisions to experts like Dr. Pramesh to advise us. And he also wanted to reassure us that please believe that your vaccines are safe. We have a strong regulatory mechanism in place. Anecdote is not evidence. We have lots of stories around. Correlation is not causation. We do not know what we are thinking is led to an event, whether it was causative or not. And also it's a myth that people have vaccine hesitancy. We're finding that more people are actually getting vaccinated. And I think from Dr. Vish, I felt this was really, really important is we need to have trust between institutions and community, trust between government and community. There needs to be trust and credible advice, and there needs to be communication on a very regular basis for us to feel that we are secure and we are being taken care of. So I'll end with this message. So while it seems we have dark clouds above, but they will move on because the blue sky never leaves us. So very, very big thank you to Dr. Pramesh and Dr. Vish for such a fantastic session. And we really look forward to having you back on another panel with the Harvard Club of India. Thank you very much.
Thank you, and good luck to all of you. We are here to work with you, help you. We are thinking of you, and we will do everything we can to be with you in these times.
Thank you so much.
Thank you. Thank you very much, Abha, for inviting me for this. And I can't get over the feeling that the way Ananya, Sonali, and Abha did it, we should probably have let them run the entire session rather than Vish and I interfering with this. So thank you so much for the invitation.
Dr. Pramesh, but thank you so much. Such a pleasure to have you. Thank you.
And we would just like to make a mention that a recording of this webinar will be available. A lot of people are already asking for it, and we'll try to see if shorter snippets of videos with key questions answered can also be shared through the networks of the Harvard Club of India and also Harvard School of Public Health India Center's website, social media channel.
Thank you.
Thank you.
Thank you so much.